I'm not allowed to talk to you about my fees because the government says we can't talk about fees. But I can tell you somewhere in the range of $275 each. Okay, so 2 surface resins in the range of $275. Okay, so in 43 minutes, that means I'm making $11.50 an hour in the range. Okay. So let's talk about a crown. So we'll talk about crowns, maybe 60 to 90 minutes for a preparation, right? Plus 30 minutes for your seating appointment. That's about 2 hours, maybe 90 minutes, somewhere in the range. You get what I'm trying to tell you. And let's say I charge somewhere in the range of $1,400 a crown. Okay. You got to take your lab bill off at $250. Okay. Your overhead's a little bit more with obviously crowns, and that's $11.50 for 2 hours. So you getting what I'm saying here, that I'm making $11.50 an hour doing 3 restorations, and I make $570 an hour for a crown. So the next objection you might have is they don't last. And he says, basically large amalgam restorations show a higher survival, composite restoration, show a higher survival rate in the low risk patient. Okay. So they are surviving. There's research out there. They followed a guy for 22 years, and they checked all his fillings. So he had 362 fillings that they watched for 22 years. Basically, at the end of it, he had 49 that needed to be replaced. 49 out of 362 in 22 years. That's the kind of stuff that I want to do at my office. So yes, I want to say they last. All right, here's an 18-year-old MOD restoration. Okay, you get it. They last. They last in my hands. 15 years old, 18 years old, 24 years old. Okay, I have these are 2 24-year-old restorations. I just took this picture last week. Here's some of the things that I use. You got to have a superior bonding agent. Okay, I don't care which one you use, but don't use the one you get in the mail. Do some research, find out which is the best ones. For me, in my hands, it's always been Caries products. Okay, so here's a bonding agent. SE Bond is one of the top. Let's talk about some what's inside the tooth here and things that we will be talking about later on. So you have your enamel layer, you have your caries infected dentin, you have your caries affected dentin. Okay, your pulp, your dental tubules. Okay. And we don't have time to kind of get into what dental tubules are, but the closer they are to the pulp, the more wet they are, the less minerals they have. The closer you get to the pulp, the lower the bonding strength. So you have an MMP inhibitor in SE Protect primer, and you have fluoride in the bonding agent. This is a superior bonding agent. And I tell you that because I'm pretty sure most of my stuff lasts as long as it does because of this product. Clearfill Majesty ES is what I use every day. Okay, I use it on anterior, posterior. It polishes well, it handles well, and it holds up really nicely. You got to use your loupes. You got to use your lights. I use caries detector on every single thing every time I cut into a tooth, I use caries detector. If you're under curing, you are making your restoration weaker. Okay, it's not going to last as long. You're going to get secondary decay, all that. So is your light good enough? Well, they did a test. They tested 130 lights. 46% of them needed to be replaced or repaired. 46%. Is that you? So let's talk a little bit about lights. Who puts it on the tooth? What direction are you putting it on? If you put it on a 45-degree angle, if your assistant is curing your light and you're not paying attention and she's not paying attention, you are losing energy. This is super important. I did my own little test with my old Kerr light back in the day. It got about 1,200 megawatts per centimeter squared. And when I bent it a little bit and I lost almost 25%, 30% of my light. So I took the Valo and I did the same thing. Valo really kicks it up a notch. But if you do it at 45 degrees, you're almost at half the power. I want you to listen to Dr. Bader from North Carolina.
Radiograph associated with the patient sitting in your chair. I ask you, what might you start anticipating you might have to do? A pulp cap, a pulpotomy, perhaps endodontic treatment, other referral, or doing it yourself. But if the patient has a deep lesion such as that one half the dentin thickness or greater, but no signs of irreversible pulpitis. And that means it's positive to a cold test. It's negative to percussion. There's no spontaneous pain reported by the patient and no periapical lesion evident in any radiograph that you have. Then the science, the evidence suggests that you ought to consider incomplete caries removal.
Let's talk about deep restoration. Look at this decay up here. A lot of decay. This person doesn't even have his second molar in yet. Saving this tooth. And this is what that restoration looked like. I'm going to make you uncomfortable. This is an 84-year-old man who had a lot more problems than this broken tooth. This was the only decay in this tooth. He had an MO that broke out and broke out the buccal cusp as well. I took the decay out. I did some electrosurge. I put a band on it. I restored it. And it's a beautiful restoration. It took 21 minutes. And he's super happy. He came back and did all the other dentistry he needed to do.